Everyone, welcome to my YouTube channel Homeopathic Understanding Simplified. Today we are gonna learn the comparison between Chamomilla and Cina. Both Chamomilla and Cina belongs to the same family Compositae. They both share similar grounds and they both are the difficult patients. The common archetype between Chamomilla and Cina are they are extremely irritable and ill-humored, and children are screaming and violent jerking will be seen, and sleep disturbance with night terrors are also seen in these patients. Convulsions and spasms and rejection of offered items also seen in both Chamomilla and Cina. Now coming to Chamomilla mental state, Chamomilla mainly seen with capriciousness. It is described as when child asks for a toy, then slings it away, wants new things every minute, satisfied with nothing. And there is also snappishness, which is manifested as impatient, intolerant of being spoken to, and spiteful complaining. The child also must be carried. Passive motion is the only thing that soothes the pain and the mind. The nurse is compelled to carry the child constantly. It is the main peculiarity of the Chamomilla child. Dr. William Borick says mental calmness contradicts the Chamomilla patient. The physical manifestation of Chamomilla are described by the traffic light signs. The red light describes one cheek red and hot and the other pale and cold. And it also describes hot, clammy sweat on forehead or scalp. And green color is described by the hot green watery fetid and slimy stools, which are described like chopped eggs and spinach or chopped grass by Dr. William Borick. And other physical manifestations like colic, often brought by anger. During teething in children, swollen gums relieved by holding cold water against them. Coming to modalities, the Chamomilla is aggravated by heat and time and emotion. Especially toothache is worse from warm drinks or warm room. Chamomilla is aggravated mainly before midnight, 9 pm onwards, and also worse from anger and vexation. And Chamomilla is also affected by environment, which is worse in open air and wind. Better by being carried or passive motion, warm, wet weather, general application of heat, except in case of teeth. Now coming to Cina, the Cina mental state is mainly described as rejection of contact or touchiness. Unlike Chamomilla, the Cina patient does not want to be touched or carried, screams if touched or handled, desires many things but rejects everything offered as that of Chamomilla, and also Cina baby is a cross, ugly and spiteful behavior. But internal state of Cina will be like abnormal consciousness as if having committed some evil deed or with guilt or fear. The physical manifestations of Cina mainly seen in the physical appearance of the baby. The face is pale, hot, dark rings around eyes with white or bluish discoloration around the mouth. There is a constant itching, rubbing, picking and boring of nose until it bleeds. In stomach, we can see that there is a gnawing hunger immediately after eating and craving for sweets, vomiting with a clean tongue. During sleep, child grinds teeth, sleeps in knee-chest position or on abdomen. Cina baby is worse by being looked at fixedly or by touch at sun or summer heat and at night, and better by motion wants to be rocked, that is a mechanical rhythm, lying on abdomen or knee chest position. Coming to key distinctions between Chamomilla and Cina is that Chamomilla is the state of hyperesthesia and Cina is in a state of reflex irritation. In Chamomilla, the anger stems from pain. The nerves are raw, the sensory nervous system is wrought up, which leads to frenzy is a response to unbearable suffering. In Cina, the reflex irritation which leads to the anger which stems from physical irritation. the brain-gut connection is disrupted, orders are not received correctly from the brain to the gut, which leads to touchiness and rejection due to internal disorder. The key clinical differentiation is that Chamomilla baby demands carry me, which is the passive motion ameliorates the pain. The child quiets down only when carried constantly. But in case of Cina children, which tells that do not touch me, wants to be rocked or rhythmic mechanical motion but screams if touched or handled, cannot tolerate warmth of the hand. In physical appearance, Chamomilla baby has a red or pale asymmetrical face with hot sweat on scalp and toothache aggravated by warmth, and fetid breath is present in Chamomilla. But in Cina, there is a sickly aspect of the face with dark circles around the eyes, white ring around the mouth, and constant boring and pricking of the nose until it bleeds, with sore or warm breath. Coming to digestion and stool, Chamomilla having a colic triggered from anger, whereas Cina baby is having the gnawing hunger soon after eating. The stools will be chopped spinach green in Chamomilla, which are hot green watery chopped spinach or chopped eggs with rotten eggs odor. Whereas in case of Cina, the stool will be milky white. White mucus resembles small pieces of popped corn. And there is a sensation of twisting pain about navel, itching of anus also present in Cina baby. In summary, the Chamomilla is the remedy of pain sensitivity, whereas the Cina is the remedy of reflex irritation. The patient demand to be carried, it indicates the Chamomilla, whereas they scream at your touch, it indicates the Cina. How can we differential diagnosis the Chamomilla and Cina? The touch test. The Chamomilla baby wants to be carried and petted and demands physical contact, whereas Cina baby don't want to be touched, screams when handled, and aversion to carelessness. The face test. One cheek red or hot and other is pale in Chamomilla with hot sweat on the forehead, whereas in Cina, the baby face looks pale and sickly, dark rings around the eyes, blue ring around the mouth with cold sweat. The scream origin. The Chamomilla baby screams from pain and anger, whereas Cina baby screams from fear, shock, or touchiness. I hope we can now clearly differentiate between Chamomilla and Cina in their respective mental, physical, and modalities aspects. Found this video helpful? Please subscribe and show your support to our YouTube channel. Thank you.